So this is an exercise to open the ribs, so get more thoracic mobility, especially through the ribs, especially through this middle section of ribs through here. Ribs pretty much from 6 to 9, this region here, which can be very stiff because they're linked to the back of the diaphragm, the linkage of the diaphragm, the back of the diaphragm to the spine. So it's a very nice stretch, this one. The couple of things. So if I do this with my foot, so that's the subtalar joint. So if I do this with my foot, that's the actual ankle joint. So here, that's making that motion happen. When I do this one here, a lot of it's coming from the joint underneath the ankle, subtalar joint, so supination, pronation. If I have my foot planted on the ground though, and I do a lunge, I've made a supinated position in this ankle, and then a somewhat pronated one here. If I was to step behind my foot, I would make it more of a pronated position. Okay, so we're just going to do the side-to-side lunge, but essentially we're making the foot stay planted, and we're moving the leg bones over the ankle. So there's a mobilization in the ankle. There's a brain connection, grounded connection through to the feet, through the tripod. So again, the tripod is the middle of the heel, center of the heel, the knuckle of the big toe, knuckle of the little toe. So there's always pressure going through those 3 points in each foot. So if I lose pressure on the outer edge of the little toe here, it's like I do this, so it peels off. And if I was to go too far, I peel off the inner edge here, so we don't want that. Or if I have my weight go too forward, I lose pressure and even contact of the heel. So I want even pressure to stay in the tripod, which means that I'm able to neurally relax and sink pressure through to the foot. So the body and the leg and all the leg joints to the foot get a spring loading. So they're able to take force, load, like loading a spring, and then I push across, unloading the spring, and it loads this one then. So as we do this, we're aiming to relax the leg, relax here, relax the knee, relax the foot. The foot's got this kind of motion. If it's stiff, it doesn't spring as well. So we want it to be soft so it has this natural spring. Okay. So that's the motion here. Then we're bending forward a bit though too. So we've got a bit of a bend forward here. So about 40, 45 degrees or so. What this allows is that the rib cage and the pelvis have a better interlinkage. Most people, when they're straight, because the hip flexors are tight, the diaphragm's not domed properly, there's not enough expansion through the back of the rib cage. The diaphragm's actually, instead of the pelvic diaphragm and the diaphragm itself facing each other, which is the best pressurization, they actually do this. Okay, so it's like the body's kind of like this all the time. Or the center of mass is forward and the head's forward. So essentially the diaphragms aren't doing their work as best as they can. Causes SIJ issues, rib spring issues, tight neck, tight shoulders, especially internal rotation, tight leg, especially internal rotation, always tight hamstrings, or always tight calves, no matter what you do. Okay, so it's called the PEC pattern. So when we bend forward here, it allows the diaphragm and the pelvic floor that are usually like this to face each other. So they're pressurized different as we're mobilizing the rib cage and allowing the tension to change in the diaphragm, respiratory diaphragm here. So there's a left and right respiratory diaphragm. They should be domed like this. The right one's way bigger and stronger attachments, tendon attachments to the spine. The left one's a bit flatter and less strong attachment. So it tends to be flatter in general. So how we do this, very simple. Comfortable step forward, that you're maybe getting a bit of a stretch in your adductors, or just you have that contact that's good. If you go too wide, you lose contact in your feet. It doesn't feel right in your knee, so we want this to be nice and smooth. Back of the hand, push across, so the ball helps you actually stretch a bit more. Push across, as simple as that. So the other hand comes here, so like it's trying to pull the other ribs back around. In martial arts, the hand's usually on the hip here for various reasons. So I'm shifting my weight. And I can change arm position, so I bring this up. So this kind of level with my shoulder, elbows level with the shoulder. So it'll change the rotation of ribs on this side, a little bit higher up. Then I come up like this, like I'm going to give someone a big slap. It'll stretch the pec, open the front of the chest. So it opens the front here, stretches the ribs a bit more at the higher up at the on that side that's up, lifting up. Then I'm lifting this arm back this way. So if I kept the arm straight, it's kind of like I'm going back like that. And that'll affect lower in the ribs. So I'm keeping my arm a bit bent so it affects fascial change differently. How I can change this now is change my breathing. So as I push across, all the air out, then I breathe in, breathe out, breathe in. So as you're breathing out, it helps this to connect better. All the air out like you're fogging up a mirror. So only all the air out. If you put your hand on your belly, on the oblique here, on the soft part, as you breathe out, it'll get solid. It'll tighten up. So we want that to stay tight. Then we breathe in, and you'll feel it expand, especially through that side where the arm is. So my right side rib cage will expand open because I've kept tension here from the out breath. So I've got all the out breath out. I keep it out. So don't let this open up at all. Then I breathe in. So the air gets shunted to other parts of the rib cage. And it's very common and normal for areas of the rib cage to always be compressed, other areas always expanded. So doing this version allows areas that are always compressed to expand and ones that are always expanded to compress. That's why this is really useful. Then I breathe out. Keep that tension here with the out breath. So you can do 1 to 3 breaths here. And you may find you can even go further on the out breath. And the last point is that when you breathe in, make it a silent, I'm making it audible so you can sort of hear what I'm doing. But the out breath is audible, so it's like you're trying to fog up a mirror. That sound gets the internal obliques working really well. When you breathe in though, make it silent, soft. So there's just a sense of expansion. What we don't want is, because it activates the neck muscles, activates a panic response in the body, it makes things actually tighter and not more released. So a soft inhale and then a somewhat forceful exhale. And we're doing 2 to 3 sets. Really good for warming up, really good for throwing sports, for martial arts, warming up the entire body this exercise can do. And we're doing anywhere from 10 to 30 repetitions.